There's a question that many men, especially when they reach 60, or silently ask themselves, a question that's often uncomfortable to discuss, even with their trusted doctor. And that question is, does what I do in my private life have any effect on my health? Masturbation or regular sex can have positive or negative effects. And most importantly, could this be related to prostate cancer? Today, we'll cover topics without restrictions, as if we were in my office, because what you do in the privacy of your bedroom, that very personal part of your life, could directly influence the length of your life and, above all, the quality of it. I'm Dr. Emily Thompson, and today we'll reveal what science really says about ejaculation and prostate health, that tiny gland the size of a walnut, but with enormous relevance. And stay with me, as the answer will astonish you. To understand this topic, it's essential to know our protagonist, the prostate. Imagine a small factory located just below your bladder. Its fundamental job is to generate a crucial part of semen, known as prostatic fluid. This fluid isn't just filler, it's a nutritious cocktail that includes zinc, citric acid, and essential enzymes to protect and transport sperm. However, the prostate doesn't act independently. Semen is the result of a collaborative effort. The seminal vesicles contribute a large part of the volume, providing a sugar-laden fluid for energy. The testes contribute only 1% of the volume, but they are the most important, the sperm. All of this combines to create semen. So how does it all work? Ejaculation is an interesting two-stage process. First, the emission phase, where all these fluids gather in the urethra, ready to emerge like actors on stage. Then, with the right stimulation, the second act, expulsion occurs. At this moment, the pelvic floor muscles contract forcefully and expel the semen. This abnormality is based on a perfect connection between nerves and muscles. Therefore, conditions such as diabetes or, as we'll see later, certain prostate surgeries can affect this process. A frequent question in my office is, Doctor, is it harmful to hold back? Accumulating semen can be harmful. There is no evidence to suggest that lack of ejaculation causes a serious illness on its own. However, it is an act that carries consequences. Imagine a river that remains still, the water not moving forward. A similar situation occurs with the prostate. In men with chronic prostatitis, a persistent and sometimes painful inflammation of the gland. A low ejaculation frequency can aggravate the symptoms of pelvic congestion. In fact, one study found that increasing ejaculatory frequency, either through intercourse or masturbation, helped many men relieve the symptoms of this condition. It's as if ejaculation cleanses the ducts, decreasing pressure and inflammation. In addition, there is a benefit that many overlook: sleep quality. Ejaculation releases a cocktail of hormones such as prolactin and oxytocin that induce relaxation and sleep. Recent research published in the journal Sleep Disorders found that sexual activity, especially when it ended in orgasm, significantly improved both the onset and quality of sleep. In addition to pleasure, having an active sex life can be an excellent natural sleep aid. Now we come to the topic I know many are eager to hear about. Concern and uncertainty mount. Ejaculating too little increases the risk of prostate cancer. Or, in other words, ejaculating more provides protection. Science has explored this question for a long time, and the findings are, to say the least, quite surprising. Let me drink some water. And in the meantime, I ask you for a small favor that helps me a lot. If you find this information useful, subscribe to the channel and hit the like button. It's free for you, and it represents a great support for me to continue generating health content. I sincerely appreciate it. Great, let's continue. The most significant research on this topic was conducted by Harvard University. They followed nearly 32,000 men over an extended period, and what did they find? Surprisingly, men who reported ejaculating 21 or more times per month had up to a 33% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times per month. Importantly, the study concluded that it didn't matter how ejaculation was achieved, whether with a partner or through masturbation. The protective effect appeared to be related to the physical act of ejaculation, not the sexual activity itself. Other studies have confirmed these findings. One study and a large meta analysis confirmed this inverse association, that is, the higher the frequency, the lower the risk. As a scientist, I must be honest, these studies are observational and rely on men's recall and reporting, which can lead to errors. However, the consistency of the results is so strong that it leads us to question, why does this happen? So, what is the hidden mechanism behind this possible protection? There is no single answer. However, the scientific community considers several intriguing hypotheses. The most intuitive is the washout hypothesis. It considers the prostate as a sponge with tiny tubes. Potentially harmful substances, carcinogens from the environment, or tobacco can accumulate in prostatic fluid. Each ejaculation acts as a cleansing, a rinsing that expels these substances before they have time to damage cells. If one doesn't ejaculate frequently, these toxins remain in contact with prostate tissue longer, increasing the likelihood of mutations that lead to tumors. The other theory is related to hormones. Frequent ejaculation could contribute to a healthier hormonal balance in the prostate, regulating levels of testosterone and other androgens, which in turn would control excessive cell growth. A third idea that I find very interesting is that sexual activity works in a similar way to physical exercise. It strengthens the immune system, which acts as our protective army, not only against viruses but also against cancer cells. An active immune system detects and eliminates abnormal cells more effectively before they become a problem. Muscle contractions during orgasm are believed to improve blood flow, reduce local inflammation, and decrease oxidative stress, a key factor in aging and the development of cancer. After hearing all this, the big question is, doctor, how many times should I ejaculate per month? I want to be very clear on this point. Although the study mentions 21 times that number, this is not a prescription or a goal you should pressure yourself to achieve. Sexual health is not about competition. The perfect frequency for each person is entirely individual and varies depending on numerous factors: your age, your overall health, whether you have a partner, your stress level, and your mood. The list is endless. Pressuring yourself to achieve a certain number can cause anxiety and stress, which is detrimental to your health. What these studies indicate is not an imposition, but an idea. Having an active sex life and a regular ejaculation frequency appear to be elements of a healthy lifestyle that benefits the prostate. It's essential to pay attention to your body and discover your own rhythm, free from pressure and guilt. Now, I want to hear from you. What's your opinion on this? Do you think there's a standard number, or is it completely individual? Share your thoughts in the comments. I'm fascinated by exploring diverse opinions. Don't forget to drink a glass of water, which is very important for your health. Okay, now let's address an important topic that concerns many men. What happens to my ejaculation if I undergo prostate surgery? It's crucial to distinguish between the two main types of surgery, as their effects are markedly different. Let's start with surgery for benign prostatic hyperplasia, BPH. This is the most common operation. The prostate grows and can press on the urethra, making it difficult to urinate. The surgery aims to unclog the urethra by removing the internal tissue causing the obstruction while preserving the external capsule of the prostate. The most common complication of this surgery is retrograde ejaculation. What is this? This means that at the moment of orgasm, semen, instead of being expelled outward, is directed backward toward the bladder. This happens because the surgery modifies the small gate, the internal sphincter, that is normally closed to prevent this from happening. It's essential that you understand this. You will continue to experience orgasms. The sensation of pleasure will remain the same, and the erection should not be altered. You will not see semen coming out. This semen is then harmlessly eliminated in the urine. As a doctor, it is essential to explain this before surgery to prevent the patient from feeling scared or frustrated afterward. The second case is quite different. It involves prostate cancer surgery known as radical prostatectomy. The purpose here is to treat the cancer, and to achieve this, the prostate is completely removed along with the seminal vesicles. By removing these organs, semen production stops. Therefore, ejaculation does not occur after this surgery. Orgasm can be experienced as a dry orgasm, although no fluid will be expelled. This surgery is also more complicated and poses two significant risks: urinary incontinence and erectile dysfunction, since the nerves responsible for erection are adjacent to the prostate and can be damaged. With modern techniques such as robotic surgery, it is sometimes possible to preserve these nerves and significantly improve results. I want you to take away one clear and powerful idea from our conversation. There is no definitive solution to prevent prostate cancer. There are no miracle diets, secret supplements, or magic ejaculation numbers. The most crucial tool you have is prevention through medical monitoring, having your annual checkups with your urologist, measuring your prostate-specific antigen, PSA, and performing a digital rectal exam when prescribed by your doctor is essential to detecting any problems early and can be crucial for your health. With this in mind, having a regular ejaculation frequency seems helpful, but consider it as one part of a broader package. What are the other pieces that have been scientifically proven to be essential? Odorless, maintain a healthy weight, eat a balanced diet, incorporating more vegetables and reducing processed foods, and then, above all, stay active. Lack of physical activity is one of the main adversaries of your prostate and overall health. Beware of online charlatans offering miracle cures. Health is an important issue. If you want more information on how to start your checkups or what PSA results really mean, I suggest you watch this other video I prepared on my channel, where I explain everything you need to understand about prostate cancer. Thank you so much for being by my side, for your support and your trust. If this video has been helpful and clarified your questions, the best way to support me is by liking it, sharing it with a friend or family member, and subscribing to the channel. Your support helps me continue creating authentic, science-based health content for more people. Take control of your well-being. See you later.